Hey there, my name is Teresa, a registered dietitian nutritionist and a certified health coach. Maybe you've been trying to get pregnant for a while with no luck, or maybe you've noticed that your cycles are super irregular and unpredictable. If you're worried that you might have PCOS, you've come to the right place. Getting properly diagnosed is tricky, but this guide will walk you through everything you need to know about the diagnostic criteria for PCOS. We'll go over the three main criteria: irregular menstrual cycles, signs of high androgen levels, and polycystic ovarian morphology on an ultrasound. You'll learn exactly what doctors look for in each category, like cycle length patterns, lab test results, and follicle counts. I'll also discuss how anti-Müllerian hormone levels are becoming a useful diagnostic tool. So I want you to get the right information so that you can advocate for the right testing. Knowledge is power when it comes to getting answers about your health. So now I want to talk about the top ways of diagnosing PCOS and all of the diagnostic criteria. So if you think you may have PCOS, the first step is getting properly diagnosed. To be diagnosed, you must meet at least two of the three Rotterdam criteria. And the first one is oligo or anovulation, and this means irregular absent menstrual periods. To be diagnosed with PCOS, you must have irregular or absent menstrual cycles. If your cycles are longer than 35 days or you have fewer than 8 periods a year, this could indicate anovulation or irregular ovulation, a hallmark of PCOS, basically meaning that you're not ovulating every month. Your doctor may order blood tests to check your hormone levels, especially progesterone, to confirm if you're ovulating. If your progesterone levels are low, it suggests you're not ovulating properly. The second criteria is hyperandrogenism. This means elevated levels of male sex hormones like testosterone. Your doctor will evaluate you for signs like acne, hair loss, hirsutism, which is excess face and body hair, or skin changes. They may also order blood tests to check hormone levels, especially of total and free testosterone. High androgen levels combined with irregular cycles strongly suggest PCOS. Elevated androgens like testosterone are common in PCOS. Your doctor may check total and free testosterone levels as well as DHEA. If levels are well above normal, it could point to PCOS or another condition. A Ferriman-Galloway score of 4 or more indicates hirsutism, which is excess body and facial hair. And then the last criteria for diagnosing PCOS is polycystic ovaries. An ultrasound can detect the characteristic appearance of PCOS ovaries, which contain many small ovarian cysts and enlarged ovaries. The Rotterdam criteria require 12 or more follicles per ovary or increased ovarian volume. However, in some cases, ultrasound may be inconclusive or unnecessary for diagnosis. Some women with PCOS have normal ultrasounds, and some women without PCOS have PCOM. Ultrasounds are not recommended for diagnosing PCOS in adolescents. Either ultrasound results or AMH levels, which are the anti-Müllerian hormone levels, may be used to diagnose PCOS, but not both to avoid overdiagnosis. An ultrasound can detect the characteristic polycystic ovaries with many small follicles around the edge of the ovary. A follicle count of 20 or more or an ovarian volume over 10 milliliters in one or both ovaries points to PCOS. Ultrasounds aren't used to diagnose PCOS in teens though, due to normally polycystic appearing ovaries in adolescents. To be diagnosed with PCOS, you must meet at least two of these three criteria, and other potential causes must be ruled out. The Rotterdam criteria are the most well-established method for diagnosing PCOS. An accurate diagnosis is key to getting the treatment and management needed to address PCOS symptoms and reduce health risks. By understanding the diagnostic process, you can advocate for yourself and ask your doctor the right questions. So getting the right diagnosis is key to developing an effective treatment plan for PCOS. You can discuss any questions or concerns you have about the diagnostic criteria and the process with your doctor, and they can determine which tests are right for your situation and make sure you get the care and answers you need. And now I want to go over a newer blood test for diagnosing PCOS, and that's called the anti-Müllerian hormone. And I sort of talked about this earlier. The anti-Müllerian hormone is secreted by ovarian follicles and it regulates their development. Women with PCOS often have anti-Müllerian hormone levels 2 to 4 times higher than normal. So anti-Müllerian hormones remains elevated even after menopause in PCOS. Either an anti-Müllerian hormone test or ultrasound can be used to diagnose PCOS, but not both to avoid overdiagnosis. So with the right combination of tests, your doctor can determine if you meet the diagnostic criteria for PCOS and recommend an appropriate treatment plan. The earlier PCOS is diagnosed and managed, the lower the risk to your health and fertility. So there you have it, ladies, a complete rundown of the criteria and tests used to diagnose PCOS. It's a complex disorder that can show up in different ways, which is why multiple factors have to be considered. The key is looking at the whole picture, looking at irregular cycles, clinical and biochemical signs of androgen excess, and ovarian ultrasound or anti-Müllerian levels. If you're concerned you may have PCOS, track your symptoms, ask your doctor lots of questions, and push for a thorough evaluation. Knowledge is power when it comes to managing your reproductive health. So trust your instincts and don't stop seeking answers until you get the full diagnosis. You got this, girly. And one last thing, little lady. I have an online nutrition course that has helped many of my PCOS sisters. It has video lessons, handouts, and so much more so that you can lose belly fat, reduce your PCOS symptoms, and feel so much better without cutting calories and giving up your favorite foods. The link is in the description box below if you want to check it out. So thanks so much for watching, and I'll see you at my next video.